Hello and welcome to the special segment on Radio Fazan 97.1 FM, which is called Voice with Annu. As usual, I do have a very special guest with me, and we are going to be discussing a very unique topic which matters to all of us. What is it called? It's called Best Start in Life. Well, becoming a parent is one of life's greatest joys, but it can also bring plenty of questions. From pregnancy to preparing your child for school, every stage of early parenthood can come with new decisions and uncertainties. Questions like, I'm pregnant, what should I do first? Am I feeding my baby the right food? Can I get the financial support with childcare? How can I help prepare my child for school? In many families in our community, parenting is very much a shared experience. Advice often comes from parents, grandparents, aunties, and friends. While this support is invaluable, it can sometimes leave parents feeling overwhelmed when different people offer different guidance. The truth is, many parents are navigating these questions every day. That's why the best start in life brings trusted NHS and government advice together in one place. A reliable voice for guidance on pregnancy, feeding, childcare, and getting children ready for school. Today, we have Benash Nazmeen to tell us more about it. She is a UK midwife and assistant professor of midwifery, whose work focuses on tackling racism and structural inequalities in maternity care. She co founded the Association of South Asian Midwives and leads nationally recognized training on cultural safety across the NHS. Benesh is also co chair of the Racial Injustice in UK Maternity Service Inquiry by Birthrights Charity, and her work has received national recognition for its impact on research and practice. Welcome to Voice, Benesh.
Thank you. Thank you for that lovely introduction as well. It's my pleasure to be here.
I'm very, very glad to have you on this platform because I've come with loads of questions to ask regarding Best Start in Life. My first question to you is, what is the Best Start in Life campaign?
So it's a national initiative with the Department for Education and the Department of Health and Social Care, and it focuses on supporting parents and carers from pregnancy through to starting the school and beyond with their little humans. So it really is focusing on bringing together trusted government and NHS advice feedback. At one point, it's hoping to be easily accessible, and it's including key factors like the Best Start in Life website, which is a resource, as well as the Best Start family hubs across England. They are part of the campaign, and the programs are starting, let me just reiterate what they're focusing on. It's bringing together their previous programs where they started to focus, they were looking at Start for Life and childcare choices under one, and it's a clear, simple brand. What this element is, so based upon previous work, they are now focusing on pregnancy, infant feeding, parent-infant relationships, childcare, early education, preparing for school. The aim is basically very simple. It's trying to make sure that parents feel confident, that they feel informed, they feel supported during the early years of their child. And that first period of life, we call it the 1001 days and more, is so important to building up the whole life of those little ones. So the website is going to have key questions that parents have, the answers to it, and it's going to help hopefully decrease some of the worries that parents might have. All those questions and all those worries are hopefully being answered for you on the website. So when you access it, we don't want you to feel like there's any question that's too big or too small. We want you to know that there's a resource available for you to access to give you the answers you need. It might be about pregnancy, it might be about when to start weaning, it might be about childcare support options that you're looking for your for your baby and your child as you're thinking about what's happening in the next steps and the activities to prepare for when children start going to school. It's all a lot, and it's so much that sometimes it's overwhelming, and it makes everything easily accessible in one place, so you don't have to ask or keep going to different places.
Fantastic. So you have nearly answered my second question, which came to me is, what is the aim of the campaign? Is there anything you would like to add to that?
I think we've answered the question. I suppose that
Yes.
the reality is just being available, having everything in one place that has been created by trusted professionals. It's evidence-based, and it informs you of that information without you potentially getting the wrong information by asking or finding it out from different places, right?
Perfect. Then, Benash, why do we need this campaign?
So, when we look at childhood and those early childhood milestones for children and children's development, they are all part of the process of knowing that your child is getting what they need and meeting the milestones that they need to. But nearly 1 in 3 children in England, they don't have the skills that they need by the age of 5 in school. That's what the statistics are saying. And every child is special, especially when we think about marginalized backgrounds, disadvantaged backgrounds. All children should have the information they need. Well, actually, the parents should have the information they need to address any of those disadvantages that exist. They can includes education, that includes health, that includes understanding around your employment and employment rights. So this campaign is part of the government's opportunity mission, and the aim of that mission is to increase the number of children that have good development from 67.7% to 75% by 2028. We want to address that disadvantage that we know existed. Research from King's College London and surveys explain to us, they show that many parents are feeling overwhelmed by the advice online. They're getting it from so many different places. They are struggling to judge what is reliable and what's false news or myths. And that often delays decisions because they feel unsure or uncertain. And this campaign is trying to address that. It's giving you the information that has been checked, that is evidence-based, that is from trusted sources in one space, and helping you feel confident and supported to make those decisions for yourself and your children early.
Fantastic. That's a great work going on. The campaign really addresses a major problem. But as I understand, and I will form my question around it, why are people from ethnic minority groups and lower income, lower socioeconomic background a specific target audience for the campaign?
Well, nearly 1 in 3 children start school without key skills. And that's more common among some of these groups that we've just mentioned, as you said, ethnically marginalized communities and socioeconomic, people from deprived areas with lower socioeconomic backgrounds. And the Early Years Foundation stage data has shown that children from these backgrounds include Bangladeshi backgrounds, Pakistani backgrounds, Black and Gypsy traveller Roma communities, that they're less likely to reach a good level of development by that age of 5. It's specifically looking at their development and how that's meeting those milestones we've spoken about earlier. And there's additional barriers that they're facing, such as language barriers. We've got complex care systems. It's difficult to navigate some of the systems we work in. There's limited culturally appropriate support. When we're from different cultures, we have different expectation, different societal kind of needs, and that cultural support that we have, the information we get, it's different. Expectations are different. We also have difficulties in understanding what the services are if you're not familiar with it or you don't have the information of what's available to you. So you don't always access them for yourself or for your children. So the research, when it highlights that these barriers reduce engagement for those services in early years, they reduce those children actually going to these services. And that includes stuff like people when they get pregnant, they don't book their pregnancy early enough, which can, impact their care, impact the decisions, impact the tests that they can have, the screening they can have that helps them understand and check the pregnancy is going well. It also can delay poor access to essential nutrients and nutritious foods and information that gets given early on. It also has, limited health literacy. I'm from a community where I know, as a migrant myself, I know that in my community, people don't have the same public health information that they have in the UK. And if you think of it from this perspective, different governments and different countries have different priorities. They invest money in public health that's related to their communities there. So in the UK, we can't expect all communities, especially migrant communities, to have that baseline public health knowledge because they haven't been exposed to those campaigns. Therefore, that information hasn't necessarily been received. So you're starting at different rates when it comes to health literacy, understanding your health, understanding when you need to go to access healthcare. And that means that there's reduced engagement in services, and unfortunately, that directly impacts all those disadvantages. I've listed so many so far that directly impacts your child and your child's development. This campaign is trying to address that and address those inequalities.
Oh, all right. So now coming to the people who are going to be using this service. So if you find out that you're pregnant, if somebody is pregnant, what should that person do? What is the first thing for that person to do?
So, first of all, congratulations, I would say. If you have found out you're pregnant and, it is something that you now are like, well, what do I do next? There's different ways to access services to book your pregnancy. And depending upon where you stay, depends upon how you do it. Historically, a lot of the time, and people still believe this is the truth, that you would have booked with your GP. And that's not necessarily the case anymore. Before, you used to go to your GP would tell you were pregnant, and then they would refer you to the midwife. And now you would access those services in different ways. And generally, people go to parents, grandparents, friends, family for advice in regards to how to book your pregnancy or get the information you need. And while that support is valuable, it's not always accurate and it can be overwhelming. So what you need to do is arrange for a booking appointment with your midwife. Now, in some cases, that booking appointment is by itself referral. Now, if you're from a community where you have a language barrier, that might mean you need help. So if you know someone in your family who doesn't have digital access or has a language barrier, they might need you to help them register to get that first appointment. And in that, you should also, if you're doing it for a family or a friend who has got a language barrier or has got digital exclusion, you should note somewhere that this is the problem so that the healthcare professionals and the team is aware. They can try to hopefully get an interpreter for them for the right language for when they do go to their booking appointment. But they can also hopefully try to address any digital connection issues, because we're going into a more and more of a digital world. And a piece of research I did, I found that every single person who was from a ethnically marginalized group knew someone in their family directly who didn't even have an email address. And in this world, you would think everyone would have an email address, and an email address is needed for a lot of that digital access, right? So yes. We want you to help your families. We want to address those barriers, and we want to make sure that early pregnancy booking happens, because it's so important that happens before 10 weeks. If you can get your pregnancy booked before 10 weeks and meet your midwife before 10 weeks, you start to have the care that you need to have, which means you have the right tests at the right times that help you make the best decisions for yourself and your baby.
To this, I have a question to ask. Why is the first midwife appointment at around 10 weeks? It is such an important moment.
Oh, yes. So, well, the 10 weeks specifically is because there are the first scan that we do that's more accurate about the baby's growth and their gestation, that tells us when the baby will be due, is done at that time. But there's certain tests that can't happen after 12 weeks, after 15 weeks. etc., etc. And in the UK, we have a comprehensive screening tools that we use to make sure that we can help you, check the growth of the baby, the health of the baby, or check if there's any conditions that are underlying for you yourself that might need treatment, that might impact the pregnancy or baby later on. And we don't always know this until you have that. So the earlier you can get your pregnancy booked and get that information, the better we can help you with planning your care appropriate for you and your needs. And that's what this website does. So the Best Start Life, on the website, they've got a week-by-week pregnancy guide as well. They've got advice on diet and pregnancy. They've got information about the appointments, and some of those appointments will be your standard appointments. Some of them will be special additional appointments. They don't have all of that information, but they have your routine information that you'll know what to expect at the very least. And they've got free weekly emails and newsletters to kind of help you with that. It's available in different languages too.
Great. Coming back to another aspect of Best Start in Life, feeding the baby. So what should or shouldn't you feed your baby?
Oh, well, we've gone straight from that, finding out you're pregnant, to already having a baby. We've disposed it in the middle. That is important too. And hopefully your trusted healthcare professional, be that your midwife and their team, will help you get to the stage where you have a baby. Now, the baby is absolutely fine and shouldn't have any solid foods initially. Going to solid foods is a big step, and sometimes parents have a lot of questions about when that should be. So the NHS, in the NHS, we recommend, and based upon the evidence, we recommend that babies should start having, or you should start introducing solid foods around about 6 months. And that's about making sure that you're starting to introduce new tastes to babies, textures, and you're starting to bring in a varied diet, because milk is, very liquid. And now they've got to find out what that means for them in their textures. And babies tend to play around with food. It's okay. It's completely normal. The baby needs to adjust as well, because they've got used to milk, and now they've got to figure out, what's this lumpy thing that mama and baba are putting in my mouth? What do I do with this, and why does it taste different? The reality is, ultimately, our meals that we have as a family should be what the baby should have, because it can be adapted. In the long term, what you're going to be eating is what your child will be eating later on, right? And people often can make things difficult for themselves by thinking that they need to go for a specific meal because that's what everyone's recommending. But what you eat, you can start introducing to them. But you need to mash it and soften it and make it easy to swallow, because they do not have teeth to do all of that. So it needs to be loose and soft and diluted as well, because, I know that we like to have some spices in our diet, and therefore we need to make them a little bit lighter for those little humans, and ideally a little bit of less salt, or no salt to begin with, for sure. Maybe salt later, and no sugar. So in that beginning stage, no salt, no sugar, soft, diluted, really easy to swallow, so that they're less likely to get anything stuck or get accidentally choking, because that is a risk. So the softer, the smoother it is, the easier they will be able to feel the difference and the thickness in comparison to milk. So that helps them transition with that. So there is advice on the website about what foods should be avoided. Some examples are honey, especially before the age of 1, because there's some risk with honey. And there's also guidance around weaning. There's a weaning hub, should I say, in the Best Start for Life weaning hub. And there's guidance around the first foods and foods to avoid, and the recipes, ideas to try for your little one, and maybe even for yourself if you want to give it a go. So you should absolutely have a look at it to help answer those questions. But I think I've given you a little taste of what's on there.
Fantastic. Thank you, Benash. Well, parenting does come with plenty of questions, and that, I think, is completely normal. When you're a parent, every question is a good question. It's a good one and is a legit one. So, well, if you have such questions, you can find out more by visiting beststartinlife.gov.uk. And if you hear Benash talk about what food should or should not be given, what should you do when you know you are pregnant, and all the other answers that she has already given, you might get more clarity around how you should be operating around before pregnancy or after pregnancy, and what you should be doing with the little human that has brought so much joy to your life. Thank you, Benash, for all the details and all the information and all your time. Thanks from the platform of Radio Fazan 97.1 FM. I'm your host, Annu, from Voice of Nottingham. Thank you again.